I come to you from India and I'm in your country. Before I begin, I always have this disclaimer that this talk is for information purposes only. This is not a substitute for a medical consultation, for which you should consult your regular doctors. Also, each child is different. No two children, even among all of us, none of us are the same. So, what may work for one child may not necessarily work for another. And the information in this talk is generalized. And most important, whatever clinical results I'm mentioning, they have been published in peer-reviewed journals. This is very important because today you don't know. I could put up anything, how do you know it's accurate? But when something is published in scientific journals, it has been what is called peer-reviewed. The journal, the editor, 3 independent reviewers verify its authenticity. So the data I'm presenting here is published and verified. So why are we here? We are here because the most precious possession in our life, our children, are not able to lead completely functional, independent lives. There can be nothing more emotionally shattering than a child to have any medical problem. Even a child has fever, you know how it feels? Even just fever, even a flu, even cough, for us, we can take anything onto ourselves. Our children know. And when our children have a brain problem, it makes it even worse. And when you're told by doctors all over, in a country like Canada, that's a developed, advanced country with among the best healthcare systems, you're told there is no cure, there is no solution, the only thing you have to do is rehabilitation. That breaks you. And you ask yourself, when there is so much science, so much development, so much happening, we are sending missions to Mars, we are having AI and we have everything. Why can't my child be helped? I'm sure this is something you think of all the time. And the question that worries you, that keeps you up at night is, as long as you're there, you'll look after your children. What after you? Who's going to look after the children when you're not around anymore? So, this is the only reason we are here. And I'm going to be sharing our experience over the last 16 years in this field. And we'll go into different facets, different aspects. But at the bottom, it is all about what can we do to help our children. So, what has changed? Why am I here? What has changed in the last 15 years is today we have a better understanding of what is happening in the brains of our children. Unfortunately, in North America, both the United States and Canada, they are not even looking into the brains of the children. Imagine you have a fracture of the leg and your doctor doesn't do an x-ray of the leg. Would that make sense? Imagine if you have some appendicitis or a stone and nobody even does an ultrasound, or if you have a heart attack and nobody does an ECG. Unfortunately, that is happening with our children. Our children have a brain problem, and in various parts of the world, nobody is even doing a scan to look at their brains. And that is among the first things we did, because when we did, we identified which parts of the brain are not working, and then once we identified that, we could find solutions. Also, there is a whole lot of understanding about what is happening from a biochemical point of view in the brains of these children, in the bodies of these children. So what is new? I'll summarize the reason for us to be here. First, and very important, is this concept of neurodiversity. There was a time when we had autism and its subclassifications, and then they decided, let's remove it and call it autism spectrum disorder. But today we've got one step beyond that. And the step beyond that is we are saying, let's even remove the word autism. That there are 2 kinds of people in the world. People like us, who are neurotypical, and people like our children, who are neurodiverse. Today the focus is on diversity. Because when you look at them diverse, you don't just look at what they can't do or what is inadequate, you start looking at what is special, unique in them that is better than us. Because diversity is not about more or less, it is about being different. And this is very important. Okay, the example I give is, some children have a hole in the heart. Have you heard that? They have a medical condition. Let's say a child had a hole in the heart. We would look at a child as a normal child with a medical problem, right? But when a child has autism, we don't look at a child as normal. We feel there's a problem in the child. That is the first thing you have to get rid of. Our children are normal children, but they are diverse. They are different. They have brains that are different from ours. So this is the first concept of neurodiversity. Second is comprehensive individualized rehabilitation, which again, unfortunately, is not available in several of the developing countries. Now, you see, I say comprehensive because rehabilitation includes occupational therapy, speech therapy, special education, ABA, psychological therapy, behavioral therapy, aquatic therapy. There's a whole facet. And unfortunately, in your countries, you get some of it, but not all of it. It's like a diet, you need to have proteins and carbohydrates and, like everything. You can't just have only proteins or only carbs. Like that, rehabilitation has to be comprehensive, and that unfortunately is not available. Then, modern brain imaging. So we have some very interesting, I'm going to show you findings on brain imaging, which are today identifying exactly what parts of the brain aren't working. Then we are going to understand what's happening within the brains. We are going to look at the concept of neuroregeneration. The focus of my talk will be on cellular or stem cell therapy, and then we look at some newer integrative therapies. So there's a lot of ground we have to cover. Like I said, our children are not less than. They are different. This is the first thing. If you just go away with this one message, mission accomplished. We've done what we had to do. Our children are not less than. They are different. So these are the newer treatment options we are going to look at today. We are going to look at cell stem cell therapy. We'll look at certain oxygen-based therapies. We are going to look at comprehensive rehab. We're going to look at the gut, because the gut and the brain has a lot of connection. We are going to look at how to correct certain micronutrient imbalance and some other things. Next, I'm going to play a short video from a movie called The Accountant. I like this clip because it explains the concept of neurodiversity very well. So there are two key points here. Our children are not less than, they are different. Okay. And the other part, that maybe they aren't able to tell us, or maybe we haven't learned to listen. All right. So it's important we change just what Manmeet said before. We have to change the way we approach them. Instead of expecting them to meet our expectations, we have to sort of adapt to the way they are. So now we are going to look at some newer brain imaging. So this is some pioneering research we did. We were, by the way, the first in the world. You're going to be surprised. So much autism all over, and nobody had looked at the brains of these children. We were the first to publish this. So we did these special scans called PET-CT scans, which whatever is blue, this is damaged. So we did a project where we took some neurotypical, or what are called normal kids, did their scans as well, and there was no blue. And now we've got scans of almost close to 5,000 children with autism. Every child has something similar to this. Every single child. Now, most important, in the brain, each part has a definite role. So the speech area is the same in all of us. The sensory brain is the same in all of us. So when a part of the brain is damaged, you know what the role of that is. And the children's problems, limitations, symptoms match this. So not only we see damage, but we see that it corresponds to the problems or limitations our kids are having. So for the very first time in medical history, we know why our children can't talk. We know why they have behavioral issues. We know why they can't read and write. We know exactly why, because that part of the brain is not working. If your leg was fractured, would you be able to walk? If your eye is damaged, would you be able to see? If your ear is damaged, would you be able to hear? If this part of the brain is not working, obviously, whatever this brain does, the child won't be able to do. So these are just technical terms. These are the areas of the brain we have identified that work less, called hypermetabolic. I mean, these are technical terms. You may not understand many of them. But a lot of this is the emotional brain. Some of this is the speech area, and the cerebellum, the small brain, is the one which is the main coordinator, or the CPU, central processing unit of the brain. But this is okay. What we found was something more interesting. We found there are parts of the brain that work more. There are parts of the brain that are better than our brains. And this is the new hope, that maybe this is a sign of the way humanity is headed. This is a sign of human evolution. In 100 years from today, maybe all of us will have brains like this. Our kids are masters at non-verbal communication. You know, we think communication is only talking, right? We blah blah and somebody listens. Our kids, they communicate without talking. They know what is going on inside you. All right. So maybe in the future, this is the next level of human mankind where we will be able to communicate without talking. So this is what is fascinating. And this is published in a very prestigious journal, the World Journal of Nuclear Medicine. This is a paper which showed what are the problems in the brain. This is published by us. And it's one of the first scientific papers that showed the world, please listen, this is the problem. You know, we told the medical community that. But then what we found was, this is data from our own paper, that the brain function with age keeps on going down. We thought that once there is a problem in the brain, that remains. To our surprise, we found that in children with autism, the brain function kept going. This is in years 0 to 5, 5 to 10. The brain functioning decreased. Now, in typically, or what we call normal children, it is the opposite. The brain function keeps on increasing with age. Did you understand? This is neurotypical children like us. This is our kids with autism. So it keeps going down. But there's something very interesting in this. I want somebody to tell me what is really interesting in this. At one point, they're better. See, look at that. Children start off better. Okay, that we didn't know this. This is like amazing. This is pure data, okay? This is brain scan data. That they actually start off better than neurotypical kids. Their brains, this is brain metabolism. This is pure science. It's not what you see because it's just pure science. It actually starts off better and decreases, and with neurotypical children increases. Now, why is this important? Because if you treat early, you have only this much to bridge. Okay, if you start treating late, okay, you have this much to bridge. So our results in children younger than 5 are very different from how they were fortunate that, you know, early on in life, whatever their parents did, you know, helped to reverse this in this direction. So this is the importance of early intervention, because, well, people keep saying, let's wait till it becomes more established, let's wait till it's available in our own countries. Well, the longer you wait, the more difficult it is to bridge the gap. Anything earlier is always easier to treat. Now, there's some very interesting new biochemical research as well. We are finding almost all our children, almost all, have low vitamin D levels. And that's particularly true of countries where you have less sun, because vitamin D is made when the sun contacts the skin. It's made by our own body. So we are finding in areas where there is less sun, but almost every child has low vitamin D levels, and we've been doing a lot of work on it, and there's actually a connection of that on the brain. We are finding a hormone called oxytocin that's less. We are finding they have certain autoantibodies. It's a little technically difficult to explain to you. We are finding elevated homocysteine levels. Homocysteine levels are elevated in people who have stroke. You know, adults who have a brain stroke, they have elevated homocysteine levels, and all our children are having, you know, it's almost like their biochemistry is like that of an adult who has a stroke. And we are finding that the mothers have elevated B12 levels. We are finding a large number of mothers, in fact, many of the kids themselves. That's why we are a little averse to general supplementation, because very often The vitamin B12 is also elevated in these kids, and this is a talk all by itself. You've done a lot of work on this, but just to let you know that these are correctable right here. Many of these things you can correct right here. In fact, you can correct them at home. You don't even have to go outside. So what is new about the treatment approach? Now, for the last 150 years, it was believed once the brain is damaged, you can't repair it. The brain is incapable of regeneration, so said all our books. But that has changed today. And the change is, maybe you can repair it by replacing the cells and repairing them. Now, the one thing that is important about autism is that it is a multidisciplinary approach. There is no one silver bullet. So what we want as parents, we should do one thing and our child will become normal. That does not happen. Stem cell therapies do not make children go back to neurotypical or normal lives. You still require everything. You require rehabilitation, from ABA to speech therapy to occupational therapy. Diet has an extremely important role. If they are heavy metals, they need to be dealt with chelation. We are using hyperbaric oxygen, biomed therapies, neurofeedback, and cell therapy is one part of an entire treatment protocol. So this is important to understand. Now, on the left-hand side, you see this bone is broken. Can you see that? It's a fracture. And I ask you, let's say any of you had this broken bone, would you do physiotherapy on this broken bone? Would you go and do exercises on a broken bone? Anybody will do exercises on that broken bone? No. What do? You go to an orthopedic guy, doctor, he will put plates, screws, fix it, and then you do rehab. Okay? But guess what we are doing with our children? Exact opposite. This is a scan of a child. This is the brain that's damaged. Okay? We are doing rehabilitation on a damaged brain and then expecting our child to improve. That brain is not functioning. What if you could fix the damage? The green is normal activity, and do rehab on this. Now you get much better results. So remember, whatever you're doing now is on damaged brain, which is why we aren't seeing the results that we should get. So a bit about autism. The thing about autism is this massive increase. So you look in 2004, it was 1 out of 166. Now these are figures from the CDC Center for Disease Control. This is from their website. You can check their website. Now look, every 2 years what is happening, from 166 to 150 to 125 to 110 to 188 to 136, and I believe it's now come down. I just heard this from a talk I'm going to show you from Robert Kennedy, who's going to be the next health minister of America. It's come to 1 in 22. Now, if this goes on without us changing anything, what's next? 1 in 10, and then 1 in 5, and then we will be the minority. These are US CDC figures. These aren't my figures, all right? Let's look briefly at autism. We all know what it is. It's a neurodevelopmental disorder. It was actually first described in 1943. Boys have it 4 times more than girls, and we call it mild, moderate, or severe. Diagnosed normally in the first 3 years of life. The main problems are problems of communication, social interaction, and repetitive behavior. So what is the fundamental problem that results in autism? I'm sure you keep asking yourself that. Why us? Why me? Why did my child have autism? The answers to that are multifaceted. Broadly speaking, it is genetic or environmental. We have seen it in a lot of families. We've seen a lot of twins having it. We've seen a lot of triplets having it. There are some genes that have been identified, but we believe it's environment factors that are more. These could be, in the prenatal and antenatal during pregnancy. So we found that any maternal infection, diabetes, depression, and the use of antidepressant drugs during pregnancy is the major cause. In one major research study done in India, we didn't do it, one of my colleagues did it in Bangalore. They studied 3,000 mothers of kids with autism. And they studied a smaller amount of mothers whose kids did not have autism. They found something startling because the doctor came and showed me the raw data. 100% 100% of the mothers of kids with autism had gone through some severe emotional trauma, depression, anxiety during pregnancy. 100%. In fact, many of them had even contemplated suicide. That, none of them attempted suicide. I'm looking at the data, and that's like so amazing. 100%. And I'm not just talking about small. I'm talking about clinical depression, anxiety. So the mother's emotional state during pregnancy is very, very important. We had in India, we had old world traditions. The first pregnancy, you went at your mother's place. You know why? Because in your mother's place, you're a princess. You don't have to do anything. There was talk of listening to religious music and bhajans and reading nice stuff and having a peaceful pregnancy. All that has changed today. Today, women are working. You're working till almost the last day of work. There are emotional pressures, stress. Earlier we had a joint family system, so there was support structure. Now you're all nuclear families. So there is a lot of focus today on the emotional health of the mother during pregnancy, and this is something that we need to look into. Nobody's looking into this. We've also found that the old age of the father or mother has a lot of consequences, because now again, so a child born to a father at 24 and a child born to a father at 45, there is a 3.5% higher risk, greater chance that 3 times more likely a father at 45 is 3.5 times more likely to have a child with autism than a father at 24. And there is an explanation for this. It's got to do with the sperms, because in males, when fresh sperms are made, they are like Xerox copies of the earlier one. It's like a Xerox and a Xerox and a Xerox. Now imagine you take a Xerox and you keep taking Xeroxes. Your 40th or 50th Xerox is going to be nothing like the original. Okay, so there's a reason for that. And today we are finding, we are all having children at much older ages. Earlier, people got married earlier and had children in the early 20s, and all that is now shifting. Mobile phone radiation. So there's a lot of work to show that mobile phone radiation during pregnancy could possibly be one of the causes, because the radiation from your mobile phone, is that working? Directly, when the child is in the womb, so if your child is here and you're on the mobile, there is a short, like a couple of inch radiation that comes from the mobile phone. That is enough to damage the brain, which is right here. And there is science to show that what happens is our brain has been given by nature a protective security guard. The medical word for it is blood-brain barrier. I'll explain what this is. See, in the rest of our body, whatever's in the blood, the good and the bad, directly goes into the heart, into the liver, into the kidney, into the muscles. Whatever's in the blood goes directly. In the brain, it can't go directly. Nature has given it a security. It's called blood-brain barrier, a barrier between the brain and the blood, which actually checks, are you okay, are you safe for me, and only then lets it enter. Mobile phone radiation during pregnancy damages the blood-brain barrier of the children. So now, even dangerous things can enter. You've removed the security guard nature gave. So just one request to anybody who's likely to have a child. I know it's very dangerous to live without these gadgets now, but you please, okay, so the mobile phone is not dangerous. It's being close to use dangerous. So if it is here, it doesn't do any harm. Wi-Fi is not dangerous. Bluetooth is not dangerous. It's the radiation from the phone, which is a very short distance. You keep it here, or you keep it in your bag, anything that's close to the body. So you can just suggest to anybody who's going to have a child now that during pregnancy to keep the mobile phones at a distance. Heavy metals, there's a lot of work to show heavy metals. We've seen that lead is one major cause. In India, they did a research project and found that one of the most popular brands of noodles had very high levels of lead in it, And now today everybody's, our children are having, when we were small, I don't remember having those noodles, but now that's the favorite noodle of all kids. Very high levels of lead. In fact, now the government had to take action. Now they've reduced that. Mercury is also dangerous and all of that. Now vaccines is a very common, you just heard. Did you hear what Donald Trump said? And you heard what, so he's talking about the President of the United States, not me, is talking about the link of autism to vaccines. Although it's a very controversial subject, very, very controversial, and there is no, so there was a paper that was published once, there was a paper published several years ago that actually showed that the preservative in the vaccine, this paper was published by Dr. Wakefield in 1998, that the preservative in the MMR vaccine could cause it. Now, the thing is, you have to understand the vaccine industry is extremely powerful. It's $1 trillion industry. And everybody came down so heavily on this gentleman. Everything was taken away from him. His degree, his job, he had to leave his country, you know. In fact, it's so bad you can't even invite him to a conference. I mean, and what did he do? He just showed there was a potential link between the preservative in the vaccine and that. And of course, after that, there have been several other papers that have said that it is not true. And so, of course, now we don't know what the reality is. Now we look at rehabilitation. Now, what we had, what Sirat's mom just spoke about hardware and software, this is very, very important. So parents think we will take our child for stem cells and our child will get normal. No. The cells in stem cells only repairs the hardware. So a brain is like a computer, and just like a computer's got hardware and software, the brain also has hardware and software. And our stem cells or cells repairs the hardware only. And that, I give you assurance, close to a clinical guarantee, and no doctor talks like that. You will not find a single doctor on the planet use the word guarantee. I guarantee improvement in the hardware. I didn't say I guarantee improvement in the child. Why? Because for improvement in the child, you also require software. So we have children whose hardware is improved. You do a PET scan before and after and you see the hardware is improved, but the child hasn't. Okay. And the reason for that is either the child didn't get enough therapies, or the environment at home was not very conducive, schooling wasn't proper, or sometimes we see that happening in older children where the brain is already, the software is already deeply ingrained, like improper software is already very hardwired. So even if you improve the hardware, the software doesn't change. So this is very important. Rehabs and teaching at home are equally important for improvement in the children. We only fix the hardware, and that I give a guarantee because we do a scan before and after and you can actually see the changes in the hardware. Now in some it improves completely, in some partially, in some a little, but in every child there is some improvement in the hardware. Now we'll run through some of the therapies. I won't go into details, I won't spend too much time. There is ABA, which we know that focuses on behavior, has something that precedes and there's a consequence. By modulating that, you can modulate behavior. That's ABA, call it. Then there's occupational therapy, which has got all these components from activities of daily living, play therapy, social skills, cognitive behavioral, all of vocational rehab. And that is our occupational therapy. And then we have sensory integration, which is also a very important part. Then we have speech therapy, where the focus now is not on motor speech, but on communication. It's not important whether you can speak fluently. It's important whether you can communicate. So that's the new thinking, that communication is more important. That speech therapy at a place. Then physiotherapy. It was earlier believed that physiotherapy has no role in autism, but we're actually finding that our children have motor coordination issues, clumsiness, tone, gait problems, postural instability and joint inattention. So physiotherapy is very important for them as well. What we are increasingly finding is the benefits of aquatic therapy. We found this to be the most useful. But aquatic therapy is not swimming. Aquatic therapy is rehab in water, and it requires skilled therapists because this is not easy. You know, you're doing rehabilitation over here, it's different. In the water, it's dangerous because if you can't handle the child can injure himself. So you need a very skilled aquatic therapist. So we believe this is important. Then there are various art-based therapies, special education. So I showed you all this to let you know that we need all of it. Unfortunately, I believe in several of the developed countries, including where we are right now, you don't get all this in one place. I mean, you get a little bit of it, but you don't get it all. And then we have to find ways. We have to do it ourselves. We have to find online sources to do all this together. Now we'll come to the main part of our talk, which is cell or stem cell therapy. So the word stem comes from the stem of a tree, and just like the stem of a tree gives rise to branches, leaves, flowers and fruits, there are some cells from which all the other cells of the body arise. A cell which can become a nerve cell, a blood cell, a muscle cell, that cell is called a stem cell. So these are different words: regenerative medicine, stem cell, cellular therapy, they're all the same. Basically, what are we doing? We are taking a good healthy cell, we are replacing the damaged cell. So if this is the damage, you give this cells and the damage goes away. All right. Now, I just like to point out, when I became a doctor, late 1980s, if I had to do a videography, I needed a video camera. For a still, I needed a still camera. If I wanted to work on a computer, I needed a PC. To listen to music, I needed a player. I needed a calendar. We didn't have mobile phones those times. For calculation, I needed this. To watch television, for a torch, compass. At that time, if somebody had told me that all these things will one day be in the palm of my hand, it would have been science fiction. You agree? You remember, if somebody had told you that time, all of this will be one day in your hand. It was beyond science fiction. It would be nobody even believe it. But it's happened. The same thing has happened with medicine, with stem cell, with cell therapy. So, if somebody had said earlier that you could modulate the immune system, repair the nerve cells, prevent cell death, release growth factors, give protection to the nerves, cause improved blood, multiply, that all this was even possible. Okay, forget all of it being made available by a single cell. That would have been science fiction, but it's become true today. So worldwide, what is happening? You see that is it only me? Is it only Dr. Sharma talking about this? No, there is work happening all over the world. So in cell therapy, neurological disorders, there are 291 papers. There are also papers in orthopedics, wound healing, cardiac, COVID. So all these conditions can be treated with cell or stem cells therapy. In autism, there are 33 papers, cerebral palsy 44, and in other spinal cord injury, head injury, stroke, etc. there are papers as well. These are worldwide publications. The medical Bible, Quran or Bhagavad Gita is a book called the Harrison's Principle of Internal Medicine. This is like the textbook, and this now is talking about regenerative medicine. This is talking about neurological conditions that we can treat. The most prestigious recognition in medicine is the Nobel Prize. People have heard of it? The Nobel Prize in medicine. Not once, but 3 times in 15 years, the Nobel Prize has gone to stem cells. 1990, stem cells and bone marrow. This is what we are doing. 2007, embryonic stem cells. 1220, again stem cells. So the most prestigious recognition has gone to stem cells.
I have spent my life exploring the mysteries of the cosmos. But there's another universe that fascinates me. The one hidden inside our bodies. Our own personal galaxies of cells. Today, we are on the brink of a new age in medicine. An age where we will be able to heal our bodies of any illness. All because of cells inside us, which have special powers.
They are called stem cells.
So that was the greatest scientist. He suffered from a disease called ALS, motor neuron disease, which we are treating. And he had developed an interest. There was a meeting scheduled. I was supposed to meet him. When I went there, he was not well. So it's really sad I couldn't meet him. But he was a big supporter of stem cells. So how do these stem cells work? First, they have the ability to multiply. So a single stem cell can become hundreds of thousands of stem cells. Second, they become any cell that you want. So the same stem cell can become a brain cell, it can become a heart cell, it can become a liver cell. Then they have the ability to improve the blood supply. So fresh blood, they attract towards it. And most important, they release certain positive chemicals that help in the healing process. So this is how they work. Because of this, they can repair, regenerate and replace. Repair, regenerate and replace damaged tissue. Now there are two kinds of cell therapy. One is autologous, where we take from the child and put it back in the child. And then there is allogenic, which you can get from somebody else and put it from donors. Now there are different types of cells. You can get what are called embryonic stem cells. So life starts when the father's sperm and mother's egg comes together and becomes a fertilized egg. And on the 5th day, this multiplies several times and becomes a grape-like bundle of stem cells. So all of us, on our 5th day of life in our mother's womb, we were nothing but a bundle of stem cells. And from this, the whole body was formed in 9 months, which means these stem cells became brain, became skin, became bone, became everything else. So that is why they have the property of becoming into anything. However, the use of embryonic stem cells is controversial. There are certain religious issues, there are ethical issues, so we don't use embryonic stem cells. You can also get stem cells from the umbilical cord. The umbilical cord is the cord that connects the mother and baby at birth. Nowadays they save it. Have any of you saved the umbilical cords? Yeah, okay. So if you saved it, then of course presently it is more useful for various blood disorders that children may have later, and we are not using it for autism. But it's a good thing you saved it, because this will be very useful. What we are using is adult stem cells. We take stem cells from the bone. So inside a bone, there is a liquid called bone marrow. You guys may have heard of this word, bone marrow. What is bone marrow? Bone marrow is the place where a body makes blood. Have you ever thought, all the blood in your body, where does it come from? Does the heart make it? Does the skin make it? Does it come from thin air? No. It is manufactured inside our bones. So the bone on the outside is thick, but inside there is a thin cavity. There's a liquid bone marrow. Now because blood is being made, the bone marrow is rich with millions of stem cells. What are the stem cells doing there? They are all going to become blood. Okay. But if you take it out, and before they have become blood, wherever you put it, it will become that. So if I take this stem cell and put it in the muscle, it becomes a muscle. If I put it in the brain, it becomes a brain. So we are using this. All right. And the last type is induced pluripotent, where the outside is adult and the inside is embryonic, but this is only in the research stage, so it hasn't advanced much clinically. So we work with adult stem cells because they are safe, they don't become tumors, they don't get rejected. You can get them from a single needle prick, there is no procedure involved, and there are no ethical issues. How do you put it back? So the way we prefer to put it back, through a thin needle, we put it into the lower back, because there's a fluid in the back which goes straight to the brain. So when you inject here, directly the cells go to the brain. But you could inject it intravenously into the arteries, into the muscles, into a catheter. You can give it through the nose, through the ventricle. So there are different ways of giving stem cells. So this is how we do it. We put a needle into the pelvic bone. So if you people feel the bone here, all of you just feel it here. You can feel that? Yeah. The reason I'm asking you to feel it is it's just below the skin. You put your hand and you can feel the bone. So this is that bone I'm talking about. Okay, so here we put a needle into that bone and we take out the bone marrow. The bone marrow which we've taken out, we take to a laboratory and we sort of filter it, separate the stem cells, and once the stem cells are separated, with a very thin needle, we inject it into the lower back from where it goes in the brain. So in the whole procedure, there are only 2 needle pricks. With one needle we take out, and with one needle we put back. There is no cutting, there is no surgery, there is no stitching, there is no ICU care, there are no lines and tubes and everything else. 2 needle pricks, right? And what are we putting in the child? The child's own healthy cells from the bone marrow. Nothing from the outside, no artificial chemicals, agents, like nothing at all. So let's see a small video of how we do this. So there you can see that bone marrow is coming out. We take it to a laboratory. And then with a very thin needle we inject it. All right. So I like to play it again. Now, worldwide, what are the scientific papers? And before we come to that, how does cell therapy work? So, there are two problems in autism. There's less oxygen to one part of the brain, and there is a problem with the immune system. And cell therapy works on both, and so it improves the connections and function. So, worldwide, there are 33 papers documenting in 461 patients. Of which 359 have improved. So worldwide, this is not ours, worldwide they have shown 80% of the children improve with stem cells. So these are different papers. The world's first paper we published from India, the next from China, Italy, 2 papers from the United States, 6 again was our paper, Vietnam, Iran and the US. So the world's first scientific paper, bone marrow mononuclear cell therapy and open label proof of cause, was published by us. This was in 2013 in Stem Cell International. And here we showed a 91% success rate in our first paper that was published. The next paper came from China and they showed a 88.8% success rate. The next paper came from the United States and that was showing again 90%. Then this paper came from the United States, Kimberly et al. And they showed a 90% success rate. This paper came from Mexico and they showed 95% success rate. And this one was from Vietnam and they showed 93%. So roughly you will see all over the world the results are between 80 to 95%. This is a paper from Italy, they showed a 78%. This is the only one which has a lower success rate. Now these are, what I showed you earlier was scientific clinical work. This is what is called a meta-analysis. That means they combine papers and 461 papers and they concluded it was safe and effective. In this other meta-analysis, again, 325 patients and they said it is safe and effective. Now, what about our papers? So, I showed you the first paper. This is our second paper. This is published in the American Journal of Stem Cells. This is a novel therapeutic strategy for autism. It's published by us. This was data from 254 patients and this is what we showed. We showed that social interaction improved in 67%, eye contact improved in 80%, attention improved in 80%, stereotypical behavior in 53%. So you'll notice that this is a little low. So a lot of these kids have stereotypical behavior, aggression. That doesn't improve in all. Aggressiveness didn't improve in all. It improved only in 56%. So a lot of our children still remain aggressive, even hyperactivity 67%, self-injurious behavior 58%. So in these behavioral section, you will notice the results are 50 to 60%. In other things, they are good. Then sitting tolerance improves 86%. Command following in 84, speech in 61. You'll notice it's slightly on the lower side. And communication in 60. So if you notice, some things improved more. Social interaction, eye contact, attention, about 80%. And behavioral issues in about 50%, speech in about 60%. Which means that all children don't improve uniformly. You know, in some speech will improve, in some behavior will improve, in some. So this is our data. This is pure raw data of our own patients. And when there's something called scores. This is ISA, CAS, these are scores. So here again you can see 94% improved in the ISA score, 95 in the CAS score. And again you'll notice the age diff, that those who are between 0 and 5, we have a 98% success rate. Whereas between 5 to 10, it dropped to 95, and after 10, it dropped to 90. So there is a drop in our results based on age. And what is the objective proof that there is an improvement? So there are two kinds of machines that do PET scans, Siemens and GE. So that's why the pictures look different. So here you can see the damage before, and you can see 6 months later, this damage is almost gone. This is gone, this is gone. This is a Siemens machine and this is a GE machine. Here again, you can see the damage before and now you can see it's improved. So of course I'm showing you one or two, but we have now close to 5,000 children with scans like this. We have a total of 16 scientific papers. The world's first paper and 15 papers after that. Also in medical textbooks, this is a medical textbook, Recent Advances in Autism. It's an international book. They have introduced a chapter, Stem Cell Therapy for Autism, and they asked us to write it. So now international editors, whenever they are looking for who should write chapters, they ask us because we have the world's largest experience. And now we'll just show you one or two kids who've improved. I normally show this every time. One of them, the first one is a child from America. The father is a cardiologist, mother is a nurse. The child was quite severe, not going to a normal school. But today this child has improved so much that he's off the spectrum, he's graduated, the father just spoke to me, about a year ago saying that he traveled all over Europe by himself. All right. I never even thought that, when I treated him close to 10 years ago, that one day he would be traveling alone overseas. And the second story is that of a mother from Nairobi, Kenya, who had triplets, all three with severe autism. You know how difficult it is to manage one child, right? Now imagine if you had triplets with severe autism. And these triplets were after 3 daughters earlier. So these 3 daughters first, and your 4th pregnancy you have triplets. All 3 of them have extremely severe autism. So let's look at these 2 stories. Yeah.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards.
He would flap like that, and he would walk on his tiptoes, look at the wall and be talking to the wall. He had problems with eye contact. He'd never look you straight in the eye. He had problems with his speech. Some research and found out about NeuroGen. And the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer, and I said, we have to do it.
We started seeing better eye contact, definitely a difference in his engagement with us, with his sibling, his mood. He was so much calmer. Now he's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. Saw the PET scan images. I can't tell you the word, we were just so excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. Ganesh has gone from the 3rd grade, 4th month reading level to a 7th grade, 1st month reading level in 5 months.
And most important, he's now getting A+ grades. Got a GPA of 3.8 out of 4. This is a little older video. It's one of my favorite. His speech is normal, behavioral issues have reduced. He's now completely off the spectrum, living a completely normal, independent life. And the next one is the story of triplets.
We went to different doctors, we went to different hospitals, and when I brought it up, they were like, oh, no, don't worry, it's because they are boys, they are triplets, they were premature. I would be walking out and I'm like, bye. And no child is crying, no child is waving back bye. And by then, for sure, I knew that they should be doing that. The children had this behavior of disappearing. In fact, Eric disappeared 3 times in the middle of the night. the biting, the spitting, the scratching. How are we going to stop this behavior? We went to see the neurologist, and in 5 minutes, he said, these children are autistic.
As parents, it was very traumatizing. First of all, we didn't understand what autistic means.
So I decided to really get to read a lot about autism. I remember the first time I read about stem cell. I was like, wow, this is really good.
We had a lot of questions which we asked, and we got very clear answers from Dr. Sharma.
The day of the stem cell itself came. Actually, I was a bit anxious, of course, but really I didn't have fear. A bit of apprehension, anxiety, of course, as a mother, but I knew they're in good hands.
We put a needle in this pelvic bone and then we take out the bone marrow, which is the fluid inside the bone. The pure stem cells, once they are ready, a thin needle is inserted into the lower back. We inject the stem cells into the cerebrospinal fluid. It flows all the way up to the brain.
Things that would have taken probably years to be accomplished in my sons, in like 8 months' time, we've really been able to come very far. Rinse with water.
They used to defecate on their clothes, but now they can use the toilet. We've seen a lot of improvement in terms of spitting. The tantrums have reduced. Sleeping used to be a problem before, but at the moment, he is taken to his bed. It takes a few minutes and he is asleep.
You see my sons cycle. You try to make them understand what it is to pedal, and they couldn't. But after stem cell, when we arrived in Kenya the following day and we went out, and these guys could cycle. I'm going to send you to buy tomato paste, okay? I'm going to send you to buy what?
Tomato paste.
In the shop. Where is the shop?
It's here.
Okay. So I'm going to give you
Money.
for what?
Buy tomato lollipop. I'm going to wear my shoes. That's right.
Parents ask me, so do you really think stem cell works? And I'm like, I can see changes, I can touch, I can feel, I can smell. Of course, for me, stem cell works. I'll do it until my children get well.
Shantanu was my first child, so I was very excited about how he would be. But when I came to know that my child has a problem, it shocked me and I wondered, why did this happen only to me?
Shantanu's behavior was very different from that of other normal children. For example, normal children walk on their feet, but Shantanu walked on his toes.
It has been 2 months since Shantanu's stem cell therapy. There have been many changes and many improvements. His hyperactivity has reduced drastically, and his attention span has improved a lot. He sits patiently in one place. He has started coordinating with his sister very well. He plays with her very affectionately. We are glad we took the decision to give him stem cell therapy. It has been 6 months since the stem cell therapy. Shantanu has shown a lot of improvements. His hyperactivity is almost as good as non-existent. His handwriting has become much better. His eye contact has also become better. I have never seen Shantanu dancing, but now he takes a keen interest in dancing. He also likes to listen to music. He can now fold clothes. Earlier he was not able to fold even a handkerchief, but now he can easily fold blankets. He helps me in cutting vegetable and in cooking too. Goes to the market store for purchases. He passed his 10th grade. There have been improvements in many other aspects as well. For example, his emotional quotient has also increased. Now he hugs us very affectionately, calls me mother. Now he takes tuitions of other special kids.
With that, I'll very briefly come to cerebral palsy. In cerebral palsy, there is damage to the brain, but unlike in autism, where you see it in the mind and behavior, in cerebral palsy, it affects the body. So either one side or just the lower limbs or the entire body is weak, tight and spastic. So there are different types of cerebral palsy. The damage in cerebral palsy is more severe. If you remember in autism, it was a light blue, whereas here you can see it's a darker blue. So in cerebral palsy, the damage is more severe. There are some medical treatments, there are drugs that you can use for spasticity, there are some surgical procedures, but they don't repair the problem in the brain. Whereas with cell therapy, this is the damage before, and after stem cells, you can see the damage is almost completely gone 6 months later. So even severe damage gets repaired with cerebral palsy. And we have published this paper. It was not the world's first paper, but it was one of the earlier papers on stem cell therapy in cerebral palsy. We've published 15 other papers. There's the International European textbook by Intech on cerebral palsy challenges for the future. Again, they have introduced a chapter, stem cell therapy for cerebral palsy, and they asked us to write it. So in textbooks on autism, in textbooks on cerebral palsy, they have introduced these chapters and they ask us to write it. Here's this child with very severe CP from Kenya. He was totally wheelchair bound, unable to move his hands and legs at all. And now you can see how he was before, completely wheelchair bound. And you can see the improvements now. You see now he's able to stand up, he's able to wear his shirt. The hands were not moving only before, and now you can see he's able to take his shirt off, able to pack a bag, able to charge a mobile phone. And something small like this, which was meant so much to the mother, that he could take out a bottle of water, open it and drink. Only a mother of cerebral palsy can understand how important that is. And see, today he is walking by himself. His walk may not be normal, but he is still independent. The other condition is intellectual disability. Earlier this was referred to as mental retardation. Now we call it intellectual disability. And here we published again the world's first paper. And this paper was a comparative paper. So we took 2 groups of patients. In 29 patients were given cell therapy and rehab, and another group was only given rehab. Because this question is, is the rehab helping or is the stem cell therapy helping? So this is the data. Now you can see this. In cognition or understanding, with only rehab, 17.8% improvement. Cell therapy and rehab, 55. Same thing, memory. Only rehab, 12%. Cell therapy and rehab, 88%. Problem solving, 24 with only rehab, 50 with cell therapy. So you can see that. Understanding of relationships, social inhibition, toilet training, 15% improved with rehab, 35 after cell therapy. Command following, eye contact, aggressiveness, attention. So everywhere you will see that with only rehab, there were improvements. But with cell therapy and rehab, the improvements were significantly more, as you can see in the blue group. So this is called a comparative study. And again, here's the data in the comparative scores, outcome measures as well. And we have published 5 papers on this. Now, this is very, very important to understand that are there any adverse events? So we have no major adverse events. Adverse events is an irreversible damage, something that the child could do before that the child has stopped doing. So no child has deteriorated. However, there are 3% of our children can have epilepsy, which is the only major risk. So these are mainly children who have had epilepsy in the past. 10% get a spinal headache, which is headache with vomiting, nausea, vomiting, local pain, etc. There is one other thing which we don't mention in complications. It's not a complication, but it can be upsetting to parents, is many of our children have severe behavioral issues after. The behavioral issues actually get exaggerated. They have aggression, they can become violent. Now this is not a side effect. This is the stem cells working. And if you take chili, if I take chili and put in your mouth will burn. That's not a side effect of the chili. The job of the chili is to have, to give you a burning or a chili sensation. So we don't put it as a complication, but for parents it can be very upsetting. Why is my child more aggressive? Now here's what happens is that as the children's understanding becomes more, but they aren't able to communicate it, they manifest through aggressiveness. And so that is something that we have to, but we don't mark it as a complication because it's not a complication actually. And our complication, so everybody in the world, all doctors only publish their good results. We are the only people in the world who've published our adverse events. So we have said that seizures as an adverse event of cellular therapy. And no other doctor has published, but we have told the whole world, listen, there can be these adverse events. So we have listed them all out. So there is something called medical ethics. So all our cell therapy work is done in permission and oversight of our health ministry, which is CDA. This is the equivalent of the FDA. In India, the FDA is called CDSCO. So we have to have something called an institutional ethics committee, which is registered with them. So the work is done with their permission. To be noted is that this is not a cure for autism spectrum. You have to combine with conventional and comprehensive rehab. Please understand, this is so important. What happens is parents will take cell therapy, will not give rehab, and not see improvements, and then say the cell therapy did not work. All right, so you have to combine it with rehab. If you don't combine with rehab, it does not work. All right, so we have several parents actually from here who actually stayed back. I remember Jasraj's parents are here. They stayed for 3 months. 3 months. Yeah. They stayed for 3 months in India just for rehab because they came here. They came to us. We did cell therapy. He improved. And then suddenly there was aggressive behavior and all of that. And then we had to, then they decided to take a very bold decision to relocate for 3 months. And then he improved there. And then again, there are various things. So rehab is extremely important. It is not a standard of care, but we call it a clinical option. Now, very briefly, some integrative therapy. So we have a whole lot of additional therapies like hyperbaric oxygen, ozone therapy, gut cleansing, diet, acupressure, supplements, vitamins. We have these all add-on therapies. So we have something called HBOT. This is oxygen given at higher pressure. The child goes into a chamber with the parent, and oxygen is given under. You see, the child is with the parent. There's a TV screen, and it's very comfortable. It's glass, so you don't feel claustrophobic. And how does this work? See, normally in us right now, when we breathe oxygen, we are now breathing oxygen at 1 pressure. So when we breathe oxygen, only the red, so our blood, this is a blood vessel, this is the liquid called plasma, this is a red blood cell, white blood cell. Only the red blood cell, the hemoglobin in the red blood cell carries oxygen. In all of us, oxygen is carried only in the red blood cell. But when you give it under pressure, the oxygen goes into the liquid. So the entire liquid is also carrying oxygen. So we find that there are a lot of benefits. The immunity strengthens, stimulates oxygenation, metabolism, energy levels. So there are a lot of benefits of hyperbaric oxygen. Then we have another therapy, ozone therapy. What is ozone? Regular oxygen is O2, ozone is O3. So it is a little superactivated oxygen. And we find it very, very useful because it kills various infections, reduces inflammation, blood clots, and is an antioxidant. It is given in different ways. There's a chamber, we can give it through the ear, we give it through the rectum, you can breathe it, there are different ways of giving it. And it cleanses the gut. We use it for part of our gut cleansing process. Then micronutrient supplementation. So we find several of our children have deficiencies of these, in particular vitamin D. So we have to correct some of these deficiencies as well. And we are now checking, the last 1 year or so, we've embarked on a massive project where we are looking at, there's a gene called MTHFR gene that converts folic acid into folate. So I'll explain this to you. We all take vitamin in a particular way in our food and as supplements. Okay, that's folic acid. That's how we take it. But our body can't use it as that. Our body uses it in the form of something called folate. Have you understood? So A is how we take it. B is how the brain can absorb it. Understood? Now there's a gene that converts A to B so that the body can use it. That B we are finding in a very large percentage, literally 3 out of every 4 kids, that gene is defective. Which means you're giving B complex vitamins that the body is not able to absorb. So then you have to give that in a different form. So we are doing a lot of work on all these aspects of, this is a little complicated topic all by itself, but we are now doing correction of this. Then we do a process of gut cleansing. So our gut has a lot of good and bad bacteria, but in our kids with autism, there's a higher incidence of not good bacteria. So what are the first things we do is we do gut microbiome testing. This is a unique test which not done anywhere else, not done so commonly here. It gives you a 20-page report. Those who've come to us have already done it, right? You've done gut microbiome, you remember that. So it's a detailed report which tells you what infection. Is it a virus? Is it a bacteria? Is it a parasite? Is it a fungal infection? So we identify, then we decide what are the chemicals that are less, what are the hormones that are less. So you remember a very detailed report, and then over 3 months we correct it. So it's a long correction process. So we first do the testing, then we identify the nature of infection. We specifically treat the infection. We use pre and probiotics. When you're there, we use rectal ozone, and of course we can't use in children, but in adults we can use something called colon hydrotherapy. There is a connection between the gut and the brain, and we believe that all this needs to be done. Then we use acupressure and deep tissue mobilization, which has a relaxing effect. In some people where there is heavy metals, we now introduce chelation, which we don't do with everyone, but only if the levels are very high. We give you advice on diet and nutrition. There are foods to eat like prebiotics, ketogenic, gluten, casein-free. There's a lot of work to show the beneficial effects of camel milk. A lot of publications, but it must be fresh camel milk. Some parents who have used it have told us that it has helped. We have to avoid, of course, sugars, additives, pesticides. See, if you do cell therapy, stem cells, and after that, let your child eat whatever he wants. Okay, if they can have the pastas and pizzas and go to McDonald's and eat whatever they want, the cell therapy is not going to work. Okay, you have to correct the diet because our diet makes us who we are. So if you're going to be pressurizing the system with any kind of diet, it's going to be very difficult. It's not easy. But the parents who are able to control the diet of their children, we find much, much, much better improvements. Okay, what is the body made of? What do you eat? Your brain cells are made of what you eat. Okay, it's not from thin air. Everything you eat becomes your heart, your brain, your lung, your kidney. And if you're going to fill it with negative, harmful things, if this is what we are giving our child, if our child is getting whatever sugar he wants, if they are getting, all our fast food and everything else that we are giving all of this, it's not going to improve. Or we have found that they have severe behavioral issues. When your diet is all not as good as it should be. Now this is difficult. This is seriously difficult. And for this, sometimes the whole family has to change the diet. You can't expect your child to eat something when you're eating everything else. The whole family, and this is healthy for everyone. So this is extremely important. I can't overemphasize this, that you have to shift to, you need to take the advice of a professional nutritionist, dietitian. You can go online. There are several sources that tell you what's good and not good. So what is really good is we need to have a high fat, a ketogenic diet is adequate proteins and low carbs. Carbs is the villain. Children with autism, remember, anything that you give is high carbs, not going to help, it's not good for your child. So what's the scientific basis of our work? We have a total of 106, not one or two, 106 scientific papers, 15, 16 on autism and CP, So these are all the papers that we have. And these are the textbook chapters. I already showed you. This is a chapter on physical disabilities in children and stem cell therapy in pediatric neurological disorders. Again, we've written this chapter. We've published 18 books. So earlier we used to write books for doctors, stem cell therapy for doctors, for muscular, and we found no doctors were reading our books. You know who was reading our books? Parents. You know. So then we said, but these books are very technical, very difficult for parents to understand. Then we started writing books for parents. Parent guide for autism, parent guide for CP, parent guide for muscular dystrophy. And all our books are, by the way, distributed. Hard copies as well as soft copies are completely free of cost. We don't charge for any of our books. We have treated, that's an old data, so it's now become 15,000. Last month we treated a 15,000 patient from 103 different countries. So my conclusions is that new imaging, I showed you new imaging. It's very important that we look into the brains of these kids and see what is going wrong. Then multidisciplinary rehab, extremely important. Medical treatments are helpful. So nobody is taking away from, you give cell therapy, there's no need for rehab. They work together. Okay, so we have to give this together. And that cell therapy can be considered a safe, effective treatment option. So today we looked at new brain imaging, we looked at conventional therapies, we looked at special rehab, we looked at cell therapy and oxygen-based therapy. So there's a lot. So what you've been told that nothing can be done for your children is not true anymore. There's stuff you can do at home, stuff like diet and all of that. Check the vitamin D level, supplement it, let your child be exposed to a little more sun. That's simple stuff. And rehab and of course cell therapy currently is not available here. You have to travel for it. So this is what we looked at in the talk. Neurodiversity, about autism, neuroregeneration, brain scanning, rehab, cell therapy, all the published work, CP, integrative and other therapies. Now this is very important that what we have found is the best results are achieved in parents who accept their children the way they are. I repeat, our children are not less than. If we think our children are less than, they will start believing they are less than. It's very, very important that we shift our thinking. You need to understand what's happening to the child, and there is so much information available. So you should know what is happening to the children. The whole family has to work as a team. We find when the whole family works together, we get the best results. What we have found is scheduling the day. Like normally the day just goes on one after the other. If from the beginning you schedule a day and stick to that over the whole week, things work better. Cell therapy, rehab works better. We have to correct the micronutrient differences in integrative therapy. Coming up in mid or late 2025 is our center in the Bahamas, in Nassau. We have government permission already. We have looked at a place. I'm traveling next weekend to Bahamas. We are hoping to make this operational. I think it will take about a year. It's getting delayed because there's a lot of work to be done. But we have the government permission. We have the place. And so in a year from now, we should be there. It will be run by us. So you'll get exactly the same treatment, though it will be a little more expensive. However, it will save the trouble of travel for people to go up and down. Before I end, I'd like to share the views of the two world's biggest democracies are America and the United States. And let's look at what the Prime Minister of India and the former President of the United States have to say about stem cells. Just to let you know that in a book that I have written, I have the privilege and honor that Prime Minister Narendra Modi ji wrote an introduction for our book. That's his signature. So in a book that I have written, I have an introduction and a message from the Honorable Prime Minister. That is myself presenting him a copy of the book in which he has written the introduction. And here's a small video of him talking in the Indian Parliament on stem cells.
मैं जापान गया तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा मैं वहाँ एक नोबेल लॉरिएट साइंटिस्ट याकामाहा को मिलने गया मैं इसलिए किया गया कि उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है क्या। हम गए तो वहां गए, उनसे चर्चा की और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें।
Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate a severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
So with that, I thank you for your attention. I'm open to any questions that you may have.